well, I will kick us off then, if that's okay, Allison. Hi, everybody online and in the room. I am Alexis. I am the Director of Environmental and Social Sustainability for UHealth, and this is my my partner in this work. You want to introduce yourself?
Yeah, Smitha Warrior. I'm an anesthesiologist, and I'm the medical counterpart to Alexis in this world of environmental and social sustainability here at the University of Utah. Alexis has this talk down, and I actually have to leave halfway, so we're going to let her roll, and I'm here for moral support and any questions that anyone might have related to kind of some of the clinical work. But
yeah, so
you won't see me.
So feel free to interrupt, and if you want to ask questions of Smitha, interrupt us early in our presentation.
I'll be back for the end.
Well, this is now, I think, the fourth year that we have done this presentation. So I'm kind of skipping over some of our usual background slides and just skipping straight to the meat of why do we care about this issue here at UHealth? And essentially it's because the healthcare sector straddles both the causes and the impacts of climate change. So we contribute to this problem, and also our patients in our health system already feel its impacts acutely. And so what we're going to talk through today is kind of how we are doing here at UHealth and how we're performing, what our current landscape here looks like on campus for the university broadly, how things are kind of situated in our local landscape here in Utah and Salt Lake City, and then what are some things that are happening at a national level. And then hopefully that'll be a good kind of pass through over to Forrest, who is from our School of Medicine, and can talk about some more things, and he'll introduce himself in a little bit. Well, first things first, we're going to do just a little bit of bragging. We're very pleased because each year we submit our sustainability data to an organization called Practice Green Health, which really helps healthcare organizations across the country benchmark themselves against themselves, but then also benchmark themselves against other hospitals when it comes to sustainable operations. And this year we actually won more awards than we have ever won before.
And I just want to add, these are also, there are peer institutions, academic, very similar institutions, they're private. It's the whole range. There's over 400, close to 5 now. And these are not participation awards. I'm one of these people who's very against oh, thank you for participating. You get a trophy. This we made very clear, this is earned. It's only there's about 20% of the groups get any award at all. They're not all the same. So this is an earned award, not a participation award. We would not be sharing just a pat on the back participation award. So it is definitely worth applause for
nice. Yeah, we're very, very excited. And so these are our hospitals that won awards this year. And then we also had a number of community clinics that won awards this year. And we'll get into a few of the things that are kind of included, or some of the things that we felt contributed to those awards that we won this year. But I also want to highlight that one area within the awards has also generated its own award, which is through the American Society for Healthcare Engineering. So ASHE, which is a part of the American Hospital Association, has a program called Energy to Care. And in order to be eligible for these awards, you have to have done an energy project that reduces a certain amount of energy during the year. And then if you do a project and then the year afterwards, it continues to sustain that performance rather than creep back up or even enhance that energy performance, then you can be eligible for what's called a sustained performance award. So this past year, we won a number of Energy to Care awards at Madsen Clinic and Orthopedic Center, and then we had a few sustained performance awards. And so you can see here that we're talking about a serious amount of sustainability energy savings. So for example, the Farmington project that was kind of a pilot that is what we sort of copy pasted to these other locations originally saved 39% total energy. And as we've done similar projects following that pilot at Sugar House and at Ortho, we've seen somewhere around 20 to 25% of energy reduced in those clinical spaces. So we're really pleased with those projects and some of the work that we've been doing. And this energy work is part of what earned us those Practice Green Health awards as well. And then I also want to kind of highlight some of the other spaces that helped us on our Practice Green Health journey. So one of the places is our renewable energy portfolio. So many people, when I give these types of presentations, they're like, why don't we have solar panels on everything? We need more solar panels. And I love that. And I just want to make sure that I'm doing a good job verbalizing to everybody that we actually do have substantial renewable energy contracts. So right now, about 20% of our overall energy portfolio, which is about 60% of the electricity for our main hospital campus, is actually provided by renewables. So we have a geothermal contract, and then we have a new 20 megawatt solar installation. And then Intermountain Healthcare are is the other entity that has the other 20 megawatts of that solar farm. So you can see here that our renewable energy portfolio has actually increased over the last several years. And when you compare how we are doing against the other hospitals that submit to Practice Green Health. So the 90th percentile is that red line across the top. And then the median is the black line. So you can see that we are performing above the median, though we're not quite at the 90th percentile. But we're performing really well on this metric. But this is also an area of opportunity for us, which we'll talk about a little bit later, because right now this is just our main hospital campus that is on these renewable power purchase agreements. So we're looking at getting more. Another place where we have made some substantial progress and we have additional room for growth is on our our inhaled anesthetics. So for those of you who maybe don't know or haven't seen our presentations on this in the past, inhaled anesthetics have a massive carbon footprint. So everything gets kind of equated back to how it compares to carbon dioxide in terms of its global warming potential. And some of these gases are like upwards of 200, almost 300 times more powerful than carbon dioxide in terms of their global warming potential. So,
and stay in the atmosphere for like a century.
Yeah. So Smitha really helped champion this work in the anesthesia department. And so you can see kind of when we first started we had already done a substantial amount of work on reducing our desflurane use even before Smitha and I started in these roles in 2021. But then we led this like sticker campaign where we put stickers on the anesthesia machines to say like what the equivalent of using DES for an hour was compared to some of the equivalent gases, ISO and SIBO. And you can see how much our desflurane really dropped off following that. And then Smitha also made some kind of changes about making it so that that gas was only available upon request as opposed to just being available in the room. And you can see how much that has eliminated. And we are actually now starting to take the next step of removing DES from formulary altogether. So we're really excited about that. The other thing that you can see here is that nitrous oxide actually makes up the largest portion of our kilograms of CO2 per anesthetic hour. And we're really pleased because in the past year, we have gone through the process of capping our centrally piped nitrous oxide. So the way that this system works right now is that there's a kind of a med gas room in the basement of the hospital that then pipes up to all of the ORs. Thanks to some of the research that came from Providence and Dr. Brian Cheeseborough, we, like many other systems, started investigating how our purchase of nitrous oxide compared against our clinical use of nitrous oxide, and we found that there was a discordance there. So what we have done is we have moved from this centrally piped system to a point of use delivery using what are called e-cylinders in the ORs directly.
And just to expand on that piece is that the central system, it's like 80 to 90, above 90% of all of our sites, it was just leakage. It's the piping, it's the central system, the maintenance of it. And this isn't unique to us. This isn't like, oh, we're not maintaining. This is all across the country. People are figuring out that our centrally piped nitrous is having these problems. And so it'd be one thing if it was saying it was all going to clinical care, to be honest, but it wasn't. It was just being put out there. And so I think that was hard because our facilities partners were great and did an amazing job. But it was, it's just complicated when it gets out of the hands of the individual provider. So we had a lot of good teamwork on this project to help with this reduction plan.
Yeah. And so we're about 10 months out from the first site that we capped, and we're less than 4 months out from the last site that we capped. But already the data shows that we've had about a 435 metric ton of carbon dioxide reduction from our calendar year to date compared to calendar year 2024 of nitrous, which is the equivalent of, like, to put that in perspective, that's about 90 homes worth of electricity used for a year, how much we've reduced in terms of our emissions from doing this project. And we estimate that will obviously go up since we're only a few months out from some of the sites that we've capped. So we're really pleased, and we expect that next year when we come give this presentation, this bar graph is going to go whoop, and nitrous is going to drop way off. We're really excited about that. A few other kind of like highlights and opportunities that helped garner these awards, and then some places of kind of where we're headed. We have a really amazing nutrition care services team that has been extremely dedicated to reducing food waste from our hospital cafeteria operations. So they've really gone through the food waste reduction hierarchy, but notably one of the things that they've done this last year is they have sent 42 tons to the anaerobic digester, which is in North Salt Lake. So they've reduced that food waste from going to the landfill. And what's exciting is that used to be only our back of house food prep that used to go there, but now they've also added in the food that comes back down from the patient tower. So if patients don't finish their food and it comes back on their trays, that is also now going to the anaerobic digester, which is really exciting. But we do have some opportunities here. So improving local and sustainable purchasing remains a challenge for us, especially because it's kind of tricky data to track and there's not an easy way. Right now, we're really having to look at each of those invoices by hand, which is not an ideal way for us to track that data. And then another thing that we have going is we're hoping to pilot reusable to-go containers over at our Helix Cafe. And with the hope that if that project is successful and it implements well, that we can scale that up to our hospital cafeteria, which has, I think it's like 3,000 to-go containers a day. It's a lot. So we have high hopes for that pilot. A shout out here. Our next thing is under green purchasing is a shout out to our IT team. They made a selection this past year of like the laptop of choice is EPEAT certified, which meant 100% of all of the laptops that we bought use less energy than their traditional counterparts. So we're really pleased with that. And then we also we've launched last year a recycling pilot over in Area E, which has been going really well. And we're hoping to scale that up in FY27 hospital wide. So, we've had a number of conversations with folks where they're like, oh, we need to recycle more. And the answer is yes, we do. And it is finally in progress. It is coming. We know this is a really important way for us to build a culture of sustainability here at UHealth.
I think that highlights something you said earlier is like the visible stuff like solar panels and recycling mean to lots of people, and it's super important. But we also want to, we love the opportunity for being here to our library colleagues to allowing us, because I think there's a lot that doesn't get seen that we just want to highlight. And there's always more to be done in this world for this work. But at the same time, it's a lot of behind the scenes type stuff, but it's happening and it's big impact stuff, as you can see, right? So recycling is super meaningful and we want people to engage and we want to make it easy to do the right thing. But the impact is not quite as big as some of the other things we're talking about. So part of the opportunity here is to really highlight that the institution is invested in some really good things. They may not all be visible.
Yeah, thank you. That's a great reminder. And actually, the next two bullets are like fall perfectly within that. So we are one of the areas that we are turning to next is really looking at how we can be more energy efficient with the imaging equipment that we use, because some of those like CT machines and MRIs use really substantial amounts of energy. Like they have a huge power draw. So we're looking with our partners in radiology about what we could do in terms of some of our kind of going into low power mode procedures. We're also looking at power purchase agreements that would benefit particularly the community clinics. So like I said, our main campus counterparts have those existing geothermal and solar PPAs that power campus. And thankfully our main hospital campus in this building are on the substation that gets powered by those PPAs. However, the buildings that we have offsite, so our Sugar House Clinic and our Farmington Clinic and our Centerville Clinic and the new West Valley Hospital, none of those buildings are on those PPAs. So we are looking at hopefully getting a new PPA that would provide at least some of the electricity for those sites and hopefully a substantial amount for the new West Valley Hospital. The other thing that we are doing is that we are doing a lot of energy efficiency audits in our community clinics. And I'll talk a little bit about the program that is funding those in a second. I also wanted to really highlight, we have some amazing clinical folks, Smitha included, of course, who are really interested in this space. And they're starting to put out some really awesome research and working within their professional societies, working with local nonprofits. So these are just a few things that I wanted to call out. But Dr. Emily Spivak has been helping create calculators that physicians who are doing antimicrobial stewardship can use to calculate the emissions associated and the waste associated with different antibiotic prescriptions that they might give to their patients. So, for example, if you have a patient who's on IV antibiotics versus oral antibiotics have a much lower footprint, and they also are better for antimicrobial stewardship. So she's put out some really interesting things. Dr. Brittany Garcia in the Department of Orthopedics was looking at the carbon emissions associated with a carpal tunnel surgery if it was done in an OR versus a procedure room, and found that procedure rooms were substantially lower in terms of their carbon footprint. And as a result, the Orthopedic Center here has actually made quite a big shift to push more and more of those carpal tunnel procedures to the procedure room rather than the OR. And then Dr. Laura Belair has really been working within the ORs at Primary Children's, where she practices as a pediatric orthopedics surgeon to reduce waste. And she's been working with medical students to do waste audits and has also been really active in her professional society to kind of push pediatric orthopedics towards reducing waste. So I just wanted to call out a few of the amazing faculty members that we have here who are really helping drive both the field and our system in particular towards more sustainable climate smart care. I want to zoom out next and go to the overall University of Utah landscape. So for those of you who follow this closely, you might recall that in 2022, 2023, we did a substantial amount of kind of community interaction leading up to the adoption of the Climate Action Plan. So in 2024, President Randall's cabinet adopted the new Climate Action Plan, which sort of outlines the key actions that we need to take between now and our carbon neutrality target of 2040. So there are 4 key areas for action there. So there is research, education, mitigation, which is really reducing our carbon footprint, and then resilience. So that was adopted in 2024. If you want to read the plan or any of the there's an annual update that gets posted in terms of how we're doing. If you want to read that, you can go to climate.utah.edu. The other exciting thing is that in 2025, we published our climate resilience plan, and this really outlines what we as a health system are going to do to kind of mitigate some of our hazards and risks as they result from climate change in terms of both clinical, but also some of our kind of facility and infrastructure pieces. So and you can go to uofhealth.utah.edu/sustainability to go read that plan. Our local landscape looks like this. So Salt Lake City has made some pretty aggressive sustainability and climate change related goals. So they have a goal to power everything within Salt Lake City to renewable energy by 2030, which is really exciting. And some of our clinics that are on the Salt Lake City, within the Salt Lake City bounds, will benefit from that. And the Utah Department of Environmental Quality, UDEC, was awarded a very substantial EPA grant, so $74.7 million, and they are enacting what they're calling the Beehive Emissions Reduction Project. And so this is really, this funding is going towards reducing emissions across the state of Utah, and they are really working hard to make sure that this funding gets distributed equitably. We're looking at both our rural and our urban populations, that we're kind of maintaining the sense of place, all these things. But this is the program that I was saying we are benefiting from right now. So they are partnering with UCrew, which is a group on our main campus that works with mechanical and other engineering students, and they go do free energy assessment audits. And so we are partnered with them, and they have come out now to 3 of our clinics so far, but we're doing 1 clinic a month for the rest of this fiscal year. And they're helping us identify energy efficiency opportunities in all of our community clinics, which will kind of help us build a roadmap of how we can get those emissions down even more. So we're really excited about that opportunity that is being funded through the Beehive Emissions Reduction Plan. If we zoom out a little bit further, I want to go to the national landscape. So there are a couple of groups that we participate in. And I guess I should say there are so many entities that are doing really great work in this space. We are just one, and this is not a comprehensive list, but these are a few that we are involved with that I want to highlight. So the National Academy of Medicine has a climate collaborative, and they have put out a ton of really great tools. And the one that I wanted to call out is this Key Actions for Health Professionals that Dr. Laura Belair, who's on our faculty, helped contribute to. And so this is a list that if you're a physician or if you work with physicians, you can share it with them. And it really is just a short list of things that people can do to make more sustainable choices in the way that they provide care. And then I wanted to end with the national curricular landscape. So the Association of American Medical Colleges, the AAMC, is really pushing in this space. They're a thought leader. They have been convening chief executives, including the CEO of UHealth and other academic medical systems, on how they can make action in this space and advance sustainability and planetary health in their curriculum. And they just published this information, basically reviewing how planetary health is growing in curriculum across the country. So you can see that from 2019 to 2024 to 2025, that the percentage of schools that have some required curriculum on climate change or planetary health has really blossomed from 27% in 2019 to now 75% of schools. And there is quite a bit of variability here in terms of how integrated that is. But we can see that it really has been growing substantially. And I think the leadership that the AAMC is showing here really helps kind of drive more progress. And then I want to end with just like a suggestion or an invitation. So the AAMC Practice Green Health, that group that I mentioned, where we who we submit our sustainability data to, and then ASHE, the American Society for Healthcare Engineering. Those three groups have come together to try host a community for climate action and sustainability in academic medical centers. And so if you are interested in joining that community, they put on webinars every couple of months. There is a very active and robust online community where if you have a question that you're wondering about, or like there's something that you want to try at your institution, there's a whole group of people who will answer your questions and say, oh, we did this here, or we did this here, or we have this advice. So if you want to register to join the community, you can follow this QR code to do that.
And she won't say this herself, but Alexis literally single-handedly started this community across all three platforms with the help of everyone else that was involved to create it. But it was her idea that she started and got lots of support and lots of people from the AAMC, Bill Mellon, super, super helpful. But she had this little nidus of an idea that she then found the right people to help her build it. So it's not single-handedly, but it was your idea that you made happen. And I appreciate that. And you should own that.
Thank you. Well, the seeds were already there, but yeah, please join our community. It's great. And that's all that I have, but I'm happy to answer any questions. And I'm hoping that kind of ending with that curricular piece will be a nice lead into Forrest, who is going to dive into what that curriculum looks like specifically here at the Spencer Fox Eccles School. So that's all I have. How did I do on time, Forrest?
That was perfect.
Great. It's your turn.
25 minutes.
Perfect.
Sounds good.
Okay, or if people have any questions right now, you can interrupt.
Don't fear grab food because we have food.
Yes, please do. People do please grab it. All right, you're up.
Put a thing to the side. Put your button at the side of this. Thank you.
All right. So yeah, while Allison is pulling up the slides and people grab food, my name's Forrest. I'm a third year here. And I'm one of the co-presidents for the Sustainability in Medicine student group, who is lucky enough to work with Alexis and Smitha quite a bit, along with about 20 or so medical students that are super passionate about this stuff and maybe one day want to do what they do for a career. So, yeah, unfortunately, everyone's super busy and I'm on step prep right now, so I'm the only one that could be here, but I'll try to give a shout out for a bunch of the other students that are doing awesome work. Allison, how are we looking?
Can you see the slides?
Yep, we're good. So next slide, if you can. So yeah, just a year in review, talking about some of the projects that move forward as well. What we mainly do is the planetary health report card, which we've presented in the past with these guys. It's our annual review of curriculum at the Spencer Fox Eccles School of Medicine. We go through and not only look at curriculum, but also support for student-led initiatives, research, how good basically the institution is at supporting planetary health activities. But most of it is curriculum, kind of looking at what we're teaching physicians of the future about climate change, what we can do about it, etc. And then I just want to give some shout outs later after we go through that on what some students are doing. So Allison, slide please. And another, perfect. And then maybe if you mouse over the metrics, we might be able to see them. But yeah, this is the PHRC. This is an example of what some of the metrics look like, how we grade our curriculum. It's a metric-based tool for evaluating and improving planetary health content in health professional schools, which basically means we are going through slide by slide, lecture by lecture, asking physicians and teachers and domain experts, okay, where does air quality show up in your teaching, in our education, and where do students engage with it? But it's not just air quality, it is vector-borne disease, it is heat, it is all the different ways climate change manifests itself in our patients' health. And also looking at some other things like this one is, how does your medical school emphasize the importance of Indigenous knowledge? And right here, we gave 1 point because it's covered in elective curriculum. It's not a core component of our curriculum, but students can engage with it. It is there. And so basically, we do this, we grade it, we give a little blurb, an explanation for the School of Medicine staff, faculty, leaders, and kind of explain our rationale before adding up all the points and giving a grade. So, Allison, slide, please. Yeah, in addition to curriculum, these are some of the other metrics, and I'll go through them one by one. So one more slide. So yeah, starting with curriculum, it's the biggest part of the planetary health report card. It's weighted the most heavily. I have a bunch of our strengths listed, including dedicated elective courses where students can engage with sustainability, what Alexis and Smitha do, and interact with them. Global health, which has a lot of overlap. I have the first one struck through though, because we've recently gone through a curriculum shift where, you know, some of this stuff has kind of gotten lost in flux for a year or so, but we're working with the physician to try and get that back, hopefully within the next year or two, because that is where a lot of our points come from. That is where students can engage with planetary health the most directly. But it also shows up in other places. The new curriculum gives us a lot of opportunity to meet with leaders, to meet with the deans, because they're seeking our feedback. It's brand new. It's very flexible. It's still kind of amorphous. And so it's pretty easy for us to get in and engage. So another slide, please. This is what we got, which is incredible. Allison, I don't know if you can see in the notes, but I'm pretty sure it was a D- or D last year. So huge jump year over year. We're pretty stoked about this. And I think this is a testament to student-led initiatives, the planetary health report card, going to the deans with the support of Smitha and Alexis, but primarily students doing this work, students making this argument, and students helping physicians implement this into the curriculum. So this is, you know, kudos to all the guys that are mentioned at the end here. I think I put the authors up again, but some things we could work on is definitely integrating more into the core curriculum. Like I said, that elective is where we get a lot of our points. And then working on, clinical integration. So this is a problem that schools across the country have. It's pretty easy to teach students about climate change in a lecture or a slide here or there, but it's really hard to integrate it into the clinical space. How do we talk to patients about this? How can we make this argument in a politically kind of amorphous world where it's taboo to talk about some of this stuff? And so that's where I'd really like us to see improvement in the future. So next slide, please. This is research, another big category. Here's a list of all the many different institutions and places students can go. Allison, I'll have you hit slide because this is just one of the U's biggest strengths. Quite frankly, this is where our institution really shines. The U, but also Salt Lake City is a big epicenter for air quality research, a lot of environmental justice work going on. And so this is where we get a really good grade. I think we did go up still. It was an A. So now we're an A plus. But I think where we can improve is that this reflects the institution as a whole. A lot of the metrics are, does your institution have planetary health research opportunities? Does your institution blah, blah, blah? So I would like to see more of a 1U approach and more unification on the health sciences campus where there is research going on, just like Alexis mentioned, but it's not quite as unified and it doesn't have the same institutional support that some of the lower campuses research does. So that's kind of where we're at there. Slide, please. Another category, support for student-led initiatives, same thing. Institutionally, we really shine. We have a lot of funding and a lot of places that med students can go. It's almost always down on lower campus. The institutions and funding mostly exist down there. So I think our opportunities for improvement are a lot of the same ones as the research category, where we can kind of get a lot more direct support from the School of Medicine, from the health sciences campus, and really unify some of the research going on up here with the lower campus's mission. So slide, please. Yeah, again, we're doing great. And we have some room for improvement. So slide, please. Okay, community outreach and advocacy. This is something that I really am excited about the student group getting more involved with in the future. So we're really excited about potentially getting involved with some pharmacy students. They do a Hill Day where they go up and meet with the legislature and make a unified argument for things that they would like to see in their community. Additionally, we have some student projects that are really centered around going out into the West Side and advocating for their health, planetary health specifically. So yeah, this is something I'd like to see improve. But slide, it's something that, you know, we have a little bit more room for improvement. We're not quite the A+. But I think, again, this was either a B- or C+, something where we're seeing the same trend of improvement across the board. And that's just, again, a testament to the students' work. Yeah, slide, please. Okay, last category, campus sustainability as a whole. Like Alexis said, we have the climate action plan. We have some of these new big plans. It's really exciting to see some really aggressive goals and milestones being put out there. I don't think I've ever seen 100% sustainable or renewable energy be proposed yet. So that's really cool to see Salt Lake doing that. Slide, please. Yeah, so I don't know if this is actually completely updated, so maybe ignore some of these bullets, but broadly, kind of the same trend, seeing students really advocate for a health sciences specific 1U approach, getting the library's green team, the College of Nursing's green team, the hospital's green team, the med school's green team, getting everyone on the same page. I would just love to have everyone meet regularly similar to this and really advocate for sustainability in a unified way, the same way that lower campus normally does. So that's our planetary health report card slide. And overall, we're really excited. This is a huge jump year over year. And then slide, please. We can look at it over the last 5 years, which is how long we've been doing it. And we see some pretty cool trends. This is what Noah Shepard, the other co-president, presented at the National Conference for Medical Students for a Sustainable Future, which is like the national version of what we are here at the U. And yeah, what else can I say about that? It's pretty cool to look at. So slide, please. Looking ahead, this is a QR code for our report card specifically if you were interested in looking at it. I really, really want to continue to meet with the deans. Alexis and Smitha have been very helpful in meeting with them, with me and the student group to try and advocate for this unified health sciences council where we can get pharmacy students, PA, nursing, dental, all the students on the health sciences campus on the same page, get excited about sustainability, meet with all of you guys, all the green teams that already exist, and just, you know, really make a unified approach to sustainability on campus. So that's our big thing. If there are any physicians or mentors on the call or in the room, you can do something right now that would be get on Mentor Connect. And this is normally how med students get in touch with people for shadowing, for rotations. You can put a little blurb in about sustainable medicine or the research that you're doing. And that makes it a lot easier for students to engage with this. And then if there's any students on the call, yeah, we're already getting going on the next report card. So feel free to email me, get in touch with anyone in the club. And yeah, we're already working on it. So slide. Oh yeah, real quick. So 5 minutes, just some student projects that are super cool. This is Olivia Hanson, Jordyn Gagon, and Ashley Chadwick, along with Emma Lester, really taking the report card, flipping it, developing their own peer-reviewed curricular materials, suggesting these to domain experts, and the domain experts are saying, wow, this is incredible. I'm going to put this in my lecture. So it comes full circle and then ends up in the report card again. So this is really, really cool. They got some funding from Lower Campus to do this. Slide, please, where we're seeing cardiovascular respiratory risks presented by climate change, planetary health concepts, heat, air quality, etc. So yeah, it's a cool project. Next slide, please. This is another project, like 9 or 10 students are involved with at this point. So this is Clean Air RX. This is a map of Salt Lake City. Anyone who's lived here for more than 6 months knows that I-15 kind of divides us right down the middle. And historically, that is how redlining has been done in this county. So on the west side, we see a higher proportion of lower income, a higher proportion of racial minorities, as well as a higher exposure to environmental risks such as pollution. And now that we have the Great Salt Lake drying as well, that presents a new unknown health risk where we're seeing arsenic, lead, all kinds of heavy metals and potentially carcinogenic materials in the air. There's been a ton of research. The EPA came through and did a 140-page report. There's been who knows how many other studies, but very few solution-oriented studies. So basically, we got funding, slide please, from Healthcare Without Harm. From the lower campus, we got a SCIF grant to basically provide air filters to these patients in Rose Park free of charge, in exchange for a survey about planetary health, as well as where they're getting their information, who they trust most, which most often across the country we find is healthcare professionals. And then also surveying students on how much they feel comfortable talking to patients about this. So kind of getting at that clinical translation of the planetary health report card, being solutions oriented. This is just the EPA's data, basically repeating the last slide. This is the EJ index, which is no longer online, but has been ported by civilians and activists. So it is still available, but showing the higher prevalence of environmental burden on the west side. So next slide, please. Okay, yep, already said that. Next slide. And next slide. I'm not sure if we have any students, but this is just a slide for them. We have some funding available. We have a leadership opportunity with the national group. Board applications are due by Halloween, so coming up. The same group that Alexis recommended, I am also in. I thoroughly enjoy it. It's a great way to connect, and there's a lot of great opportunities. And then we have a conference coming up in February where you can either present virtually or also apply for funding to travel to DC and meet with the national group. So those are some cool things coming up. That's all I got. Thank you, guys.
All right. Do we have any questions? And if you're online, feel free to chime in either in the chat or live if you like. And if there's any questions in the room, of course.
Yeah. So I was in a meeting recently where it was Academic Senate, and the president, Randall, had announced that they were putting 20 million, 50 million, a large amount of money towards AI. And one of the people, somebody else in the meeting, was really concerned about its sustainability and the environmental effects of AI. Can you give more insight into that? Is there something that we could do in that space? Yeah.
I have a few thoughts. So I will say that I know that the U in general has started the new responsible AI initiative. So that might have been what they were talking about. And I know that one of the elements that they are looking at within responsibility and responsible use of AI is environmental. So that is a part of kind of their that group's framework for how they're thinking about AI as an institution. I will say that this is definitely a really hot topic in sustainable healthcare right now. And there was actually a absolutely fascinating session about this. So the National Academy of Medicine held a all-day session a couple of weeks ago, and I would be happy to send you the recording if you want to go down that rabbit hole. But I the takeaway that I had is that yes, AI has like some very serious environmental impacts. And when you compare AI's environmental impacts to the healthcare sector environmental impacts, it's minimal. And so like, yes, we do need to address those. Like we do need to think about water conservation, and we do need to think about the tremendous amount of energy that AI will take up. And if we look at the healthcare sector broadly, like some of the impacts that we have otherwise in terms of like our pharmaceuticals and the things that we order, like that is actually a much higher comparative footprint to work on. So like that was one takeaway. The other takeaway is that AI really could be something that we could use to help us address some of the climate health impacts that we see and feel, if we do it in a good way. And there's also a really interesting paper that just got put out that was like clinical guidance for how to implement AI in clinical scenarios with environmental sustainability in mind. And so that was like an interesting paper that I think is also worth looking at, especially as our system maybe looks at like, oh, how can we use AI scribing or some of these other tools that would relieve the burden on our physicians, and would potentially allow us to provide more sustainable care. Those are a few thoughts. I don't know if you're enforced.
I know that one of the clinical AIs passed my board exam I'm studying for with 100%. So it's absolutely something that students and physicians have to learn to work with. How that looks in terms of like clinical sustainability, I'm not really sure. I haven't done as much reading as Alexis has, but it's definitely something that's not going away, as you guys said.
Yeah, I think it's like it could be a tool. It could be a like very helpful tool in this fight. But that also means that we need to deploy it responsibly. Yeah, I don't know. Does that answer your question? So kind of long with it.
Yeah.
Any other questions? Anyone online?
Or comments,
For
or not
comments?
jokes.
A comment I have is just we've been doing this for a few years, and it seems like this year has been incredible. Even if just looking at one piece or the other, like the report card is finally on an upswing, and we're getting more awards than before. And it's almost like, how are we doing so well when we're kind of in a political environment that doesn't necessarily have our same vision? So those are my
Yeah.
thoughts.
Yeah, I guess I will say, my observation is there are a lot of systems that are doing great work, and in some ways are like maybe doing that work a little more quietly. Like they're just kind of like keeping their heads down and continuing to do the great work. And I think that's a very viable option. And to some extent, that's kind of, how we're just continuing to do the things that we know are impactful. The other thing is, I think, or part of how we've been able to continue success that we're seeing here is a lot of the stuff that we're doing is, well, one, the right thing to do, but two, we also have been seeing some pretty substantial cost savings as a result, right? Like, as we've worked on the nitrous capping project, for example, it's not a huge amount, it's not like we're saving millions and millions of dollars, but we are seeing savings because that nitrous isn't going to waste. As we've been doing these energy efficiency projects, we are seeing our utility bills go down. So I think, right, like that stewardship of resources and stewardship of our like monetary resources is like just makes really good sense. But yeah, I won't deny that it's like the current like financial streams and some of the other things, like the current ambiance that we are operating within is definitely changed over the last couple of years. So, but we're still doing good work. I don't know. I remain very hopeful that like we and the many, many other peer institutions who are engaged in this work through Practice Green Health and ASHE and the National Academy of Medicine and the AAMC, like we're continuing to push it. And I think on the student side, like students really care about this issue, and they're like really a driving force for change, especially, I mean, certainly at this institution, and I think that's nationwide.
Yeah. Cool.
Yeah.
As reflected by the AAMC's data and the growth of the report card in just 6 years. Yeah, it's here. I'm just here, and students recognize it, patients recognize it. And yeah, it's something that is going to continue to be a driving force no matter who's president.
Mm-hmm. Yeah, and I guess, I will also add, like, just as a note of hope, there's this like survey that goes out. I think it's the American climate leadership survey. I can go find it and like send it out to this group if there is interest. But one of the things that has like come out very clearly is that the majority of Americans actually do see and feel the health impacts of climate change, especially around extreme heat. Like there's a lot of people have coalesced and like see and feel that very actively right now in their communities. Like I have an almost 2-year-old, and like I could not take her to Sugar House Park like after 11 a.m. this summer because the playground equipment was too hot for her to touch. Right. So like that is, I think, a very common experience for people across the country. And the thing that I guess I would say is like, I think there's a false narrative that, oh, like the majority of people are naysayers or deniers. And like, that's actually not what the data show. Like the majority of Americans are concerned about extreme heat. They are concerned about some of these health impacts of climate change. And like the reason why most people aren't talking about it is because people don't talk about it. So like I just would say, that there are certain like talking about these health impacts is like a very good way to open a door to a conversation that everybody cares about their health. Everybody cares about the health of their families and loved ones. And like we're feeling like I think here locally we certainly feel these impacts, and across the country we feel these impacts. So like if you're thinking about it, know that you're not alone. And I invite people to have those conversations with your friends and your neighbors.
Lynn, you have your hand raised.
I do. I actually have a question that's twofold, but relates to the same thing, one for students and one like for faculty. So on the faculty side, have you done more to bring environmental impacts into basically faculty scholarship and recognition? Has there been anything to help drive that? And then on the student side, I'm not with a medical school. We have a school of health sciences with all the other health professions. And most of our programs are accelerated because the students want to get through them faster. So my question's more about integration. This is extra work. This is not stuff that's already part of our curriculum. And so, the faculty adding it, then the students, do they stay longer so they learn this, or are you integrating it? So if you have any guidance, I know that's a complicated question, but that's the thing that kind of has us stuck.
Yeah, I'll speak to the faculty part first, maybe. So I will say that there are some challenges where this is like not exactly incorporated into current RPT processes, right? Like it's not necessarily as highly valued as we would like to see it in those processes for faculty. And I think if it was more so, that would really help drive some of this work. But I guess what I am seeing within some of the folks who are getting really active in our spaces is that there's plenty of publication opportunities, right? Like Dr. Belair just barely published a paper about communicating around this issue with other surgeons. Like I think this is a really growing, and I don't know if I would say nascent space, but definitely like a primed space for additional publication. And I think our institution, like many others, really we value having additional publications that go out. But yeah, I think it's like tricky to integrate it into that. But we do also see that we have a number of chairs who are really supportive of this work, even and like are willing to protect faculty time. But I don't have a great answer of like how you fix that at a systemic level. I wish I did, but I'm sorry, I don't.
I just want to say your awards that your recognitions and then the economic savings, maybe that's helping balance it.
Yeah, totally. And I think, I think that as the students actually push for it, that will also help, because I think, at least within our School of Medicine, right, like our hospital chief executives are like, they're starting to build this like more integrated together system with our School of Medicine. And like our School of Medicine faculty are the people who are serving as preceptors in our hospitals. So like, I think as the students request this, we will start to see more of that value too. But yeah. I don't know what you would say for the integration piece.
110%. Honestly, it surprised me how many students are willing to do extra work, but the goal is not to make this extra work. The goal is for complete integration, both top down and bottom up, because it's been studied when integrating planetary health curriculum, what the biggest roadblocks and obstacles are. And normally it's students feeling like, oh, this isn't going to be on my test. This is a waste of my time. That's one of the biggest obstacles, which is hard for us to hear because we're super passionate about this, but that's just a reality. And so complete integration into lectures, into clinical sciences, would be like our bottom-up approach, like the slides that I presented. And then also a top-down approach. I know AAMC, MDME, there's work groups dedicated to building core competencies surrounding planetary health, which is what they build the exams on. So all that is to say, hopefully it does start showing up on step 1, step 2, clinical exams and other health sciences, where students are then like, oh, okay, yeah, it's going to be on the test. It's worth it. And then for the students that are, maybe a bit more concerned about climate change and planetary health and the reality of how it affects our patients, then we also have resources and integration within preceptors, faculty, available for those students.
Yeah. And I guess I will add, I think what I've heard from schools that have done a really good job of integrating this successfully is what Forrest said, where it's not really extra. It's like, okay, if you're having a lecture, and I realize that you kind of said that you're like some of your programs are more in the allied health sciences, not necessarily the School of Medicine, but like, right, if you have a dietitian program, they probably are going to have a number of lectures around plant-based or plant forward meal planning, right? Like that's an opportunity where if you have that slide, you could very easily talk about the environmental footprint of a plant forward diet compared to a meat-based diet.
Absolutely. I'm actually also a dietitian with all this. And so I've already done that in our dietetics program, but then, we get asked to teach nutrition to PA students or to nursing students. So I'm actually teaching it from health, sustainability, and social justice and, equity but I'm the only person everyone thinks I'm kind of crazy. But we're trying to show that students still learn nutrition. Like we're not taking away from it, but then we've actually increased their belief that it's within their scope of practice.
Totally.
So
you're not alone and you're not crazy. You're doing great work. How about that?
thank you. If you know anyone else on the diet side, let me know. I'm trying to find people that we can actually develop validated tools to show you can integrate these things. It's actually better to teach it that way.
I actually probably do know a few folks who I could connect you with. So I don't know. Hold on. I guess I'm on this meeting. Wait, I closed my laptop. I'll put my email in the chat.
Thank you.
And then we see we have a hand up.
Yeah, Yara.
Hi, so thank you for hosting this. I'm joining from LA from USC. I'm actually in the dental school. So I was really happy to hear that you're reaching out to the dental students. And I have to say it is a struggle. I mean, I've learned not to say sustainability. So like I just had a meeting today and it's all about efficiency. Can we see patients in one appointment as opposed to 2, by improving what we do? So that's the way I'm trying to approach it.
Yeah. I think that my observation is there are some kind of ways that we can talk about this that hold a broader appeal. And so identifying what things will resonate with your audience is a really critical way to move the work forward.
Appeal to health, appeal to economics, cost savings, and appeal to the greater good for us that are a little more idealistic. But there's a bunch of different ways to kind of spin this argument and use different language and get at the same goal. There is a report card for dental students. So if you have students that are interested in being involved, I'd love to chat with them and potentially get a report card started.
Okay, great. And yeah, I know University of Washington, I know they did one. So we're just, slowly working towards this, but thank you.
There is a planetary health report card for dental schools now, right?
Yeah, there's.
We have not yet. Our School of Dental students have not done it. They had one small kind of contingent that was meeting, but I think that group might have phased out. Yeah.
Awesome. Any other final questions before we wrap up here? Going once, going twice. All right. Well, on behalf of the Eccles Library Sustainability Committee, thank you, Alexis, Forrest, and Smitha for your presentation today. And thank you all for joining us online and in person. We'll catch you at the next one. Thank you.
Thank you.